Hi, this is Dr. Brandy Hawk, psychologist at UC Davis Children's Hospital. Today I'm going to talk to you about assessing for postpartum depression. What is postpartum depression? It is major depressive disorder that occurs at any time during the first year after birth. Postpartum depression should be distinguished from the baby blues, which typically resolves within 10 to 14 days postpartum and affects a much larger percentage of moms. Nearly 50 to 75% of moms will experience the baby blues. Symptoms of postpartum depression are the same criteria as major depressive disorder, and symptoms must last greater than 2 weeks. One of the most common symptoms for postpartum depression is anhedonia, or a loss of interest in usually pleasurable activities. We often commonly see mood lability, anxiety or feeling overwhelmed, irritability, obsessional worries, especially about something harming or happening to their child, and it can include thoughts of hurting themselves or hurting their baby. Why do we need to assess for postpartum depression? As pediatricians, it's important to note that even though postpartum depression is an adult mental health disorder, it is common among your patients and it impacts the children that you work with. Postpartum depression is very common. It affects 12 to 20% of all postpartum women. It's also highly dangerous, with a 20% rate of suicidality among women who are diagnosed with postpartum depression. It's not only dangerous for the parents, but it also impacts their children. Parents with postpartum depression are more likely not to breastfeed their children, to have lax safety rules in their house, to not attend well-child visits, and are less likely to put their children on their back to sleep. Not only this, but when parents have postpartum depression, they are likely to form a poorer attachment with their infant child. An attachment in those early months is crucial to a child's development of well-being and positive mental and cognitive and behavioral development. When parents have postpartum depression, their children can be impaired in social emotional realms, as well as with language, cognitive development, and mental health concerns as they get older. Additionally, children whose parents had postpartum depression have been found to be at increased risk for respiratory and GI infections. So it is important that we are assessing all of the parents that come in with their newborn babies. So how? First thing to do is to screen all postpartum mothers. Every single mother that comes in for a newborn well child visit should be screened at minimum with these 3 questions via interview. First, has the parent been feeling down, depressed, or sad recently? Second, have they experienced little interest or pleasure in doing things that they used to enjoy? And third, have they had any thoughts about hurting themselves or hurting the baby? If the parent says yes to any of these, you should refer for further assessment. If the parent says yes to having thoughts about hurting themselves or the baby, you should refer right away for crisis intervention. We also recommend using the Edinburgh Postnatal Depression Scale at 1, 2, 4, and 6 months postpartum. Remember that postpartum depression can happen anytime during that first year of life for the baby. So it's important that we keep assessing throughout that year rather than only right after the baby is born. Importantly, postpartum psychosis is rare but also devastating. Only about 1 to 2 out of 1,000 women who have postpartum depression will have postpartum psychosis, but when they do, they are at very high risk for suicide or for harming their child. Things to ask all parents are whether they found that their mind is playing tricks on them, whether they've heard sounds or voices or are seeing things, and second, whether they feel like someone is going to hurt them or the baby. If either of these are positive, refer right away for crisis services. So now what? You know what postpartum depression is, and you've screened for it, what do you do with a positive screen? Well, if you are concerned about postpartum depression, start with a mental health referral, both for an assessment and potential therapy. Provide resources to the parent to help them cope and normalize what's happening. And provide a crisis service referral if you have significant concerns, especially about harm to the mother or harm to the child. No matter what, if you are concerned about postpartum depression and refer for other services, make sure to follow up within 1 month to ensure that the parent has received those services and to check on how they're doing. We also want to provide anticipatory guidance to all of our families. Even if a parent does not have postpartum depression, they're likely going to struggle. It is hard to be a new parent, and we want to normalize that for our families so that they don't feel alone, but that they feel supported. So we want to make sure to normalize the struggles of being a new parent. You also want to assess dads. Dads can have depression as well in that first year, so make sure to ask them those same questions. Provide strengths-based interventions. Ask what's working well for them, ask what supports they have, and then build on those supports so that they have help when they need it. And encourage all parents to practice self-care. It's very easy when you have a baby to forget about the need to take care of yourself, but encourage families to get as much sleep as they possibly can, to take care of themselves, to eat well, to exercise, and to do the things that they've always enjoyed doing. Remember that children thrive when they have healthy, supported parents, and so we want to support our parents to be the best possible parents they can be for our patients. And we want to provide resources as well. If you need to make a referral, make sure that you coordinate with the mom's PCP or OB physician. This is important because they might be making referrals as well, and you want to be working as a team. You can refer to Outpatient Psychiatry for an evaluation. You can also visit the Psychology Today website for therapy referrals and talk to the Ambulatory Case Managers for assistance with referrals. There are additional online resources and articles included at the bottom of this video for you to look over after you're finished with the video. So make sure that we are assessing for postpartum depression throughout the whole first year of the child's life. And when you have a positive assessment, make sure to refer, and not only refer, but check in to make sure that your parents and children are doing well. Thank you.